Coming up next on the Delaware Way, we talk to one of the top health officials in Delaware about the opioid crisis and what she thinks about legalized recreational marijuana. This is the Delaware Way. Welcome to the Delaware Way. I'm Larry Menti. The nation is dealing with the opioid crisis. State by state is trying to deal with the numbers of people who are overdosing from heroin, fentanyl, and opioids. How is Delaware doing? Dr. Karyl Ratay is the Director of Public Health in Delaware, the Division of Public Health. Thank you so much. I appreciate you being here. I know the 95 corridor has been awful for opioid. I know the whole country is dealing with this, but opioids along the 95 corridor especially have been hard hit in New Jersey, New York, Pennsylvania, Delaware, Maryland. I keep looking at the numbers, and it seems like state after state, they're throwing funding at it, and yet the numbers don't seem to move. How are we doing in Delaware?
Yeah, we're all struggling, but especially in this part of the country. Delaware had a horrible and tragic year last year in 2018 with about an estimated 419 deaths. And you may remember when we began talking about this crisis, we had about 100 deaths in the state of Delaware. So we've quadrupled our number of deaths since that time. And a lot of this is driven by fentanyl that's been, shipped in, mailed in through China, from China, and it's just ubiquitous now within the illicit drug supply. So people might think they're using, whether it's a safe dose of heroin in their eyes or even cocaine, and are immediately getting a very potent, fentanyl, which is about 40 to 50 times more potent than heroin. So many people are dying because of what's in the drug supply now. And
I know you're a part of the effort to bring down those opioid deaths. What are we doing? I'm sure it takes several fronts.
Absolutely, and I'm glad you asked that, because there is no one single answer to this. This is so complicated, and even though we've made some progress, we all know this was driven by high prescribing of opioids, and we still have very high prescribing of opioids, pain medications, as well as we're not doing as good as we can with pain management. So prevention is critical, and we're still doing a lot on the prevention front. That includes things like, working through schools and with communities to prevent initiation in the first place of these drugs. We're doing a lot of work to better engage people into treatment and to increase the treatment capacity, as well as within the treatment system ensure that it's a comprehensive, coordinated system that really successfully engages people into treatment and into recovery. So we are making a lot of progress on those fronts, but the reality is, it's a challenging disease to deal with. Opioid use disorder has, it's not uncommon for people to have relapses, just like with diabetes and other chronic conditions. And we need to ensure that if an individual overdoses, that somebody around them has the overdose reversal medication, naloxone, to reverse that overdose, so we can save a life and then work hard to get them into treatment again.
One of the things that is so troubling sometimes to people about someone who's overdosing being brought back and then just say go home, and then they do it again, and then they do it again, and they do it again, is that they're not getting the help. You're bringing them back, but they're not getting the help. So there are some that think that when you bring somebody back, they should be required. There should be some type of judgment. They should go through a process where they have to go into rehabilitation at that point. Would you agree with that?
We have a lot of efforts underway to more closely follow individuals who have overdosed, and we've actually Delaware's the first state in the nation to develop what's called an overdose system of care. And so once an individual has overdosed, ensuring that a patient-centered approach is taken to getting them to the right place. Most people don't want to go to the emergency department. It's not a place where they're really getting their needs met. They're also sometimes stigmatized in the emergency department, and they just don't want to be there. We're working on other approaches where they might go to a place called a stabilization center, which might be more appropriate.
Isn't it still their choice?
It is still their choice.
Should they be forced at that point to go into it? Because at the same time, they're taking an illegal drug. I mean, I understand you still want people to come to you. You want people to call you and say, I'm talking about first responders, you want people to call first responders and say there's someone that overdosed. You don't want them to not make that phone call because they're afraid. So I know it's a fine line to walk, but at the same time, these people aren't getting help.
Yeah, it's an interesting question. Right now, the treatment system isn't quite prepared for, this crisis itself, but to take people in voluntarily, that's a kind of a whole different treatment approach where, you have to essentially lock people in to treat them. Certainly, treatment works much better if you can convince people that they want treatment. One of the tools that we found and that the science really supports is using somebody called a peer coach, somebody who themselves has the life experience and understands addiction and can really relate to individuals who have overdosed or who are struggling and really help them get engaged into a treatment program that's going to work best for them. So we think that really is the best way to engage people, but you got to make sure that, again, it is a treatment program that works for them, and that the evidence isn't really strong that if you
Force somebody.
Yeah, it's kind of like when you put them in prison, you're forcing them to be, they can't have access to drugs when they're in prison, but oftentimes then when they leave prison, they go right back out and use. And in fact, that's a very high risk time for people dying.
We're going to come back in a second. Every time you're here, we talk about the flu. So I want to bring that up when we come back because that can be equally as dangerous. I want to talk about that and also just touch on marijuana, both medical marijuana and recreational marijuana, when we continue our conversation with Dr. Karyl Ratay, Director of Public Health in Delaware, the Division of Public Health, when the Delaware Way continues.